Welcome back to 843 TV here at Encompass Health Hospital, and joining us now is the medical director, Dr. Somaio, and you're a native to the Low Country, so welcome.
Well, I've just relocated here from New York. I have 16 years of experience in acute inpatient rehabilitation, and Encompass recruited me to come down and be the new medical director of this beautiful facility. So,
and beautiful it is, isn't it?
It is. You know, so welcome to the Low Country. You know, your specialty is in strokes, and this is actually a hot topic that I would like to talk to you about, because the facility is really known to how to care for patients who's had a stroke. Start us off with somebody's had a stroke and they've come to here from a primary hospital to have rehabilitation, and then what happens with that patient?
So we provide a much higher level of care than the nursing home type rehabilitations. We are able to do 3 hours of therapy a day, 5 days a week. That's the recommendation of the American Heart Association for stroke recovery guidelines. And that's what separates Encompass and acute rehabilitation from the subacute facilities that are common.
So what other complications after having a stroke were we looking to help this patient recover from?
Yes, so when someone has a stroke, it can affect them physically. They can have paralysis, they can have paresthesias or funny feelings in their hands. They can have balance difficulty, they can have visual difficulty. They can also struggle with things like bathing, dressing, just brushing their teeth and combing their hair. So we address all of those things. In addition, they can have speech problems, and we have speech therapy here, as well as difficulty just communicating in general.
Absolutely.
How long does a patient stay here? Are they here for quite a while until the conditions get better? I mean, what's this?
It depends on the severity of the stroke. Some patients may be here only about 5 or 7 days, others may be here several weeks. You know, our goal is to get people from the acute care hospital to home, and we try to do that in about a 2 to 3 week window for strokes.
So you've just been here a short while.
Yes.
In your brief experience so far, share with us a little bit about the patients you've interacted with and just in general.
We've met some wonderful people. You know, it's a different part of the world from what I'm used to in the Northeast, so people tend to be very, very sweet, very outgoing, and able to discuss lots of different things with you. And you know, we've seen a gamut of different injuries, strokes, we've seen falls, we've seen just a lot of people that need to come through acute rehabilitation.
What about folks recovering from maybe injuries after accidents or anything like that? Do you see some of those
Absolutely.
patients?
We see car accidents, bicycle accidents, falls from ladders, any type of trauma are things that we would definitely deal with.
You hate to say it, but in this area, there's a lot of that just because of the outside nature of the area.
Well, you know, I was at the Hilton Head Hospital about a month ago, and I was out talking to the ER, and they said, what's the number, I asked them, what's the number one accidents, and they see it are bikes.
Yes.
Yeah.
The number one is bike, broken bones, and then the biker without the helmet.
Absolutely.
And then there's a head trauma involved.
Correct. And head trauma, traumatic brain injury is a very common diagnosis. Everything from concussion to the more severe injuries that kind of mimic strokes.
Yeah. And so as a practitioner, what are you passionate about? Obviously you love this part of the medicine.
Yes, this acute rehab is unique. You have a multidisciplinary team. You obviously have physicians, you have wonderful nurses, you have physical therapy, occupational therapy, speech therapy. We're going to bring in neuropsychology. So you have a whole gamut of teams that all work together to really get these patients back home, back to their regular life.
Share with us about the rest of the staff here as far as the medical staff. You obviously oversee that you're the director. What about the physicians, and how does that break down?
So right now, you know, I'm the medical director, and what we're trying to do is build relationships with all the local community hospitals. We have several different physicians in the community that come give us support, but it's a matter of building these relationships with the hospitals and allow some of those clinicians to come in and work with us.
Yeah, but it's, you know, I'm excited for you because I can sense that, you know, you really have, as a practitioner, you have a chance to really make a difference in so many people's lives. And the team around you, you know, it's deep. And it's all inclusive.
It's wonderful. You almost become part of these patients' lives.
Yes,
and,
absolutely.
And you know, even after you send them home, a lot of them come back, and a lot of them are very thankful because you've really made a difference during one of their most difficult times.
Not just for the patient, but the family members, the caregivers, and in a lot of cases, a lot of them may not be here because of the nature of our area. People have retired and settled here, and their family is up north, and And so just the peace of mind knowing that there's a facility that can really help is, I'm sure, a huge added value.
Oh, without a doubt. I've been very impressed with the facility for sure.
Absolutely.
Well, I want to say thank you for joining us.
Thank you very much.
And yeah, and we've learned a lot today here at this facility, especially in this great room. And so we're happy that you all joined us for this episode of 843 TV.
Where communities come to speak.